Good afternoon. As a land grant institution, we would like to begin by acknowledging the Gabrielino Tongva peoples as the traditional land caretakers of Tavangar, that is the Los Angeles Basin and South Channel Islands. Welcome, everyone. Thank you for joining us today to learn more about the California Elder Index. We're excited to share updates that we've made to the California Elder Index, as well as to introduce it to those of you who may not be familiar with it. My name is Catherine Keatsman, and I'm the Director of the Health Equity Program here at the UCLA Center for Health Policy Research. I am joined today by my colleague, Senior Research Scientist Imelda Padilla-Frausto, who's also one of the early architects of the California Index. We're also joined by undergraduate research student, Natalie Kim. Natalie is majoring here at UCLA in computational biology and political science. And we're very glad that she's able to join us in this presentation today. If you would like a copy of today's slides, please email our communications team at healthpolicy@ucla.edu. This webinar is being recorded and will be posted to our website and YouTube channel in the coming weeks. Before we get started, I want to share with you a very exciting upcoming event. The California Health Interview Survey Annual Data Release webinar will be held on Thursday, October 9th. Part of the UCLA Center for Health Policy Research, the California Health Interview Survey is the largest state-based population health survey in the nation. In 4 weeks, we will release comprehensive data on the health and healthcare needs of California's large and diverse populations. Each year, CHIS interviews, as we call it, CHIS, more than 20,000 households, including adults, adolescents, and children, on a wide range of topics, including use of and access to healthcare, health conditions, health behaviors, mental health, housing and food security, climate change, community involvement, public program participation, and so much more. Topics can be viewed by county or region, age, race, ethnicity, gender identity, sexual orientation, income level, military service, and other demographics. As a center, we are committed to putting data into the hands of people who need it. And the CHIS data will be made publicly available through accessible online tools, publications, and trainings. The CHIS team will share 2024 survey findings at this data release webinar. We hope to see you there. Our communications director will post the link to register in the chat. So before we move into today's presentation about the California Elder Index, I would like to acknowledge the generous funding support provided by the California Department of Aging, all that made this work possible. The CEI project has many parts, and we've required talent from several teams, including other members of our CEI study team who are not presenting today, but have made valuable and thoughtful contributions to all of this work. These team members include Chen Yun Wang, a UCLA doctoral student in social welfare, Mohammed Khorgamfar, a recent UCLA MPH graduate who just started medical school in Arizona, Sitara Diunugala, who completed his MPH at the University of North Carolina and has just started a PhD program in public health at UC Irvine, and Lauren Vuong, another recent UCLA grad who is currently getting her MPH in epidemiology at Stanford University. She's also going to be helping us with Q&A today, so you may see her later on in this presentation. And finally, Shreya Paul is a research data manager here at CHPR, the Center for Health Policy Research, who has expertise in data visualization software, including the Tableau software we're using to present our CEI dashboards. In addition to the work of our CEI team, we have relied heavily and benefited greatly from the expertise and diligence of our CHPR communications and information technology teams, who have ensured that all of our CEI projects and products look great, are functional and accessible, and are being promoted widely through a variety of communication channels. So today we're going to walk you through several facets of our CEI work, starting with a high-level introduction to the CEI, what it is, how it was created, and why it is important. We will show you how the CEI serves as an equity tool that provides data dashboard estimates that reflect a more accurate cost of living for older adults than other cost measures. We will also share information about the demographic profiles that can be created from the CEI dashboards, features that enable the user to understand how age, sex, and race and ethnicity intersect with measures of income security, and show how these demographic characteristics may account for variations in levels of economic security. After walking through a few examples of CEI income security and cost trends over time, we will then briefly discuss how the CEI can be used to inform policy and practice, both at the state and at local county levels. We will wrap up by sharing some ideas for future directions, and we'll then open up time for discussion and responses to the questions that you have raised in the Q&A box. So what is the California Elder Index? The California Elder Index, or CEI, as we will most commonly refer to it throughout today's presentation, evolved from a national measure of economic security called the Elder Economic Security Standard Index that was developed by researchers at the University of Massachusetts, Boston, starting back in 2007. Recognizing that California's demographic and geographic landscape is quite different from other states, in 2008, the late and great Professor Steve Wallace collaborated with advocates at the UCLA Center for Community Economic Development and consulted with the researchers at UMass Boston to adapt the National Elder Index for the Golden State's unique context. The goal was to develop a more California-specific measure of economic security that better reflects the regional or county level costs and the individual and household demographic diversity that exists in California among older adults who are 65 years of age and older. In these ways, the CEI expands on the National Elder Index to better represent California's diverse population and older adult living situations. In addition to single older adults and older couples that are represented in the National Elder Index, the California Elder Index represents 5 more household types, including, for example, older adults who are raising grandchildren or other minor children, older adults housing adult children, and older adults housing adult children and grandchildren, all of which have different implications for the cost of living. California is the first and only state that has institutionalized the use of the CEI, starting with AB 138, which passed back in 2011 and required the 33 areas of aging in California to use the CEI in their 3-year area strategic plans, which provide a framework for equitably allocating resources to support effective programs and policies, which are funded by federal Older Americans Act dollars. The CEI is presented visually in the form of 2 interactive data dashboards, one representing the cost of living, the other representing the demographics of older adults, all of which can be stratified at the county level. The end result is a California-specific measure of economic security for older adults that represents the local costs of all of the state's 58 counties. The CEI uses a more comprehensive set of cost components to produce a more realistic cost of living estimates for older adults in California. These cost estimate calculations are grounded in an analysis of local market rates for food, housing, healthcare, transportation, and other miscellaneous yet basic necessities. The main objectives of the CEI are to provide a more realistic assessment of basic living costs for older adults in California, to go beyond existing poverty measures to estimate the income older adults need to attain economic security and live independently with dignity, and to provide an equity tool that can be used by a broad array of stakeholders to both measure and promote income equity among older Californians. I'm pleased to now turn the presentation over to Dr. Imelda, who will discuss the importance of the CEI and how it differs from other poverty measures. Walk us through some examples of recent CEI data points and comparisons, and introduce what we are calling the CEI income gap. Imelda.
Thank you, Dr. Keatsman. So yes, I was one of the original architects of building the CEI for California. And so I've learned a lot over the years of why the CEI is so important. And one of the main reasons is that the existing poverty measures, such as the FPL or the supplemental poverty measure, really underestimate the income that older adults need in California. And one of the reasons that happens is because it is a outdated measure, according to scientific researchers, that was developed in the 1960s, but based on 1950s food costs. And so in these years, since then, it has not changed very much. It is given a inflation addition every year, but it has not kept up with the changes in the cost of living, nor does it really reflect the costs that older adults face. And because of that, we are not seeing, we're not identifying other older adults who are economically insecure. And these older adults have housing and food insecurity. They have difficulty accessing health care, or they have to make dire choices between having a roof over their head or eating healthy or taking their medication. And this ends up resulting in a lot of chronic stress and poor health outcomes for older adults that are not considered not having enough income per the FPL. Next slide. As I mentioned, the national federal poverty level is, created in the early 1960s and based on food cost only. And the reason why we are looking at comparing the FPL with the CEI is because the FPL has been institutionalized in a lot of our policies, and they are used to determine eligibility for federal aid programs, also state programs such as Medicaid, also known as Medi-Cal in California, and the Supplemental Nutrition Assistance Program called CalFresh in California. And these programs could benefit a lot of older adults if we had appropriate measures to identify older adults that do not have enough income to meet their basic needs. Next slide. So to give you an example of what we're looking at, so here is from 2015 to 2023, we're looking at the federal poverty level for one person. And back in 2015, that was $11,770 per year that people are expected to live off of. In 2023, we see that has increased to about $1,500 per year that older adults are expected to live off of. In states like California, I don't think that's really possible. In contrast, when we look at the California Elder Index, which includes not only the cost for food, but includes the cost for housing by different housing types, it also includes cost for healthcare, which is a huge expense for older adults, and includes a cost for transportation, and that's minimal transportation to like local doctor visits, grocery shopping, and things like that. And then miscellaneous costs, which is a small amount of the total cost of those other cost components to take care of things like personal care or house cleaning supplies, things of that nature. And so in 2015, what we saw was the elder index was about $24,000 annual. And in 2023, we have calculated the California Elder Index to be about 3,200 per year. Next slide. So when we look at these two measures, we see an income gap, which is the difference between the federal poverty level and the CEI. And back in 2015, we saw that income gap was about $12,000. So older adults needed about $12,000 more than what the FPL accounted for to meet basic living expenses. In 2023, that gap has, well, over the years, it has been increasing. And so in 2023, we see that gap coming close to about $18,000, more than the federal poverty level. Next slide. And so when we look at CEI as a percentage of the FPL, sometimes programs will increase their eligibility to like 138% of the FPL, maybe go up to 200% in some instances. And so what we've seen over the years is that the CEI as a percentage of the FPL has hovered around 200% of the FPL, but it has increased over the years, where we see in 2021, we see a increase to 220%, 227% of the FPL that older adults need to meet their basic living expenses. And in 2023, that was 220% of the FPL. So just to give a brief overview of what we just talked about in comparing the California Elder Index to the federal poverty level, the California Elder Index is based on current standard of living. So we look at current costs that older adults are facing in real time. Whereas the federal poverty level, as I stated before, has been based on a 1950 standard of living and hasn't really changed much since then. The other big difference is that the California Elder Index is a county level data. So we calculate the CEI at the county by county, and we also calculate it by housing type. So renters versus homeowners with or without a mortgage, have very different housing expenses. Whereas the federal poverty level is a single national value. No matter where you live, no matter what sort of housing, you live in, it's just one single value for everyone. The other main difference, as we talked about, it includes costs for food, housing, healthcare, transportation, and miscellaneous costs. Whereas I mentioned before, the federal poverty level is based only on food costs. Next slide. So to give you an example of what we're looking at in sort of the CEI, the cost of living for single older adults by housing type, we have here in the blue bars, we have the highest cost county in the blue bars. In the orange bar, we have the California average. And in the green bar, we have the county with the lowest cost. And so in the first left-hand set of bars, we see that San Francisco has the highest cost for renters, and that's about $51,000 per year to meet their basic living cost. The lowest county is Kern County at about $24,000. And the California average for a single renter is $32,000. And then in the middle set of bars, again, San Francisco is one of the counties with the highest cost for homeowners with a mortgage at about $60,000. And the county with the lowest cost for homeowners with a mortgage is Modoc County, and that's about $33,000. Compared to the California average, which was about $45,000. And then in the right set of bars, we see that Santa Barbara actually is the county with the highest costs for homeowners with no mortgage, and that's about $28,000 for Santa Barbara. The county with the lowest cost is San Bernardino with about $20,000, and the California average is about $24,000 for homeowners without a mortgage. Next slide. And so in this slide, in these slides, next few slides, what I want to show is that the monthly costs, so these are the cost components for older adults, and these are their monthly costs. So for all California counties, or the California average, what we have here in blue are costs for the food, red is housing, orange is healthcare, green is transportation, and the light blue is miscellaneous. And I want you to keep your eyes on the orange and red bars. For California counties, for all California counties, or California average, housing for homeowners without a mortgage was $690. For renters, that was $1,337. And for homeowners with a mortgage, that was up to $2,437. Next slide. For a urban county, a rural county such as MODOC, where we have housing is lower than the California average, homeowners without a mortgage have cost of $436 for their housing. You see here in the red is much smaller than the California average. For renters, that was $673. And for homeowners with a mortgage, that was $1,262. So you see all the red bars are smaller than the California average. However, the orange bars, which represent the healthcare costs, are higher than the California average. And in MODOC, the cost for healthcare per month was $553 compared to the California average, which is $413. So healthcare costs were higher than the California average, but their housing was lower than the California average. Next slide. In the next slide, we see costs for urban counties. So this is for San Francisco, where we see housing is much higher than the California average for renters and homeowners with a mortgage, and definitely a lot higher than rural counties like MODOC. So renter cost in San Francisco were about $3,000 versus $1,300 in MODOC, which is 222% higher. And homeowners with a mortgage, we saw their housing costs as high as $3,643 versus $200,437 that we saw. I think that's a California average, and that's 150% higher. However, what we've seen is that the healthcare costs are much lower than the California average in an urban county. So we're looking at $229 versus $553 in rural counties. And that's a 190% difference that we're seeing between a rural county healthcare cost and urban county healthcare cost. I'll explain that in the next slide. Since the Elder Index is meant to be a conservative estimate of the cost of living, healthcare cost is one of the costs that was adapted for the California Elder Index and differs from the National Elder Index due to a higher uptake of Medicare Advantage plans more than other states. So the CEI methodology for healthcare cost actually examines the enrollment rates of Medicare Advantage in each county. For counties that have an enrollment rate below 20%, which is typically found in rural counties and represented by the yellow line in the chart, includes the costs for original Medicare Parts A and B, premiums, Medicare supplemental insurance, also known as Medigap, Medicare Part D, and out-of-pocket costs. Whereas for counties that have an enrollment rate 20% or greater, which is typically found in urban counties and represented by the blue bar in the chart, or blue line in the chart, sorry, includes the costs for Medicare Advantage plan, the premiums for a Medicare Advantage plan, and out-of-pocket cost. And so what we see over time, when we're looking at trends, we see that rural counties or counties that have enrollment rates, Medicare Advantage enrollment rates below 20% actually have seen higher costs and a higher increase over the years compared to counties that are assigned the Medicare Advantage cost, and that's counties with enrollment rates above 20%. And we see that the difference between the two increasing over the years, where, in 2013, the sort of what we call the original Medicare in the yellow line is $361, and the Medicare Advantage was $245. And then in 2023, we see this huge increase for counties that are assigned the original Medicare, up to $557, and compared to $273 for counties with Medicare Advantage plans. Next slide. So in these next few slides, we're going to be looking at trends in economic security. So actually taking the cost of living for older adults and looking at their incomes and seeing where they fall within the CEI and the FPL. So we look at them both together. So I want to explain a couple of terms that we have been using. Next slide. So we want to introduce the CEI income gap. This has previously been known as the hidden poor. We have changed this so that we focus on the income that is missing or that is needed for older adults who are economically insecure or who have income below the CEI. So here in these bars, what I have is the FPL, 100% FPL for one person, in the dark blue bar, which is $14,580, and this is annual cost. And then in the gray bar in the middle, we're looking at 200% of the FPL for one person, and this is just sort of to give you a something to compare what 200% of the FPL would look like. And so that's at $29,160. And then in the light blue bar, we have the California Elder Index for a single renter in San Francisco. So as you saw in the previous slides, rent costs were really high for older adults in San Francisco. So when we look at the incomes of older adults, when they have income below the CEI and below the FPL, those are often what the FPL considers in poverty. So we look at those folks and we assign them to this category below the CEI and FPL. When their income, next slide, increases above the FPL, but still below the CEI income gap, these are folks we identify and categorize in the CEI income gap. And so you see this huge gap between 50,592 of the CEI down to 14,580 for the FPL. Next slide. We then take this group CEI income gap and split them into two different income gaps so that we can assess a little bit finer of who is in these different pockets of economic insecurity. So one group that we look at is what we call the CEI low income gap. And these are older adults with incomes below 200% of the FPL, but above 100% of the FPL. So we identify them as having income in the CEI low income gap. Next slide. And then we have another group, which we call the CEI middle income gap. And these are folks that have income that is still below the the CEI, but higher than 200% of the FPL. And so we look at this group and see that, you know, there's still a lot of older adults in this group that fall in this category. And so next, I'd like to introduce our colleague, Natalie Kim, who will go into more detail about these older adults who are living in economic insecurity. Natalie?
Thank you, Dr. Imelda, for the introduction of our different income gaps. So, focusing on some economic insecurity trends, the following visualizations around roughly the next 3 slides are going to show the percentage of individuals that are occupying each income gap, and all the data is from 2015 to 2023. So first, we have 3 different older adult groups shown at the top. So the first group is the all older adults, which is going to be demonstrated through the gray. And then we have older couples only, which will be demonstrated in dark blue, and single older adults living alone, which will be demonstrated in light blue. So this first panel shown on the screen is demonstrating the individuals with income below the CEI and FPL. And based on this graph, we can see that the single older adults living alone in the light blue have the greatest percentage of individuals in this income gap, but also the greatest percentage increase across the 8-year time period. So as we can see in 2015, it was 20%, and then it increased to 23% in 2023. And then for both all older adults shown in gray and older couples only shown in dark blue, we can also see again that there is an overall percentage increase from 2015 to 2023. And this was roughly around 1%. So for all older adults, we went from 9% to 10%. And for older couples, we went from 6% to 7%. Next slide, please. So now we're going to shift to the next income group, which is the CEI low income gap, which is again individuals or older adults who occupy below the CEI and roughly between 100 to 200% of the FPL. So similar to the older adults living in poverty, we see that single older adults living alone have the greatest percentage of individuals occupying this income gap. However, we also see that the percentage of individuals decline across the same time period. So as we can see in 2015, we start off with 22%, but in 2023, we end up with 19% of individuals, of single older adults. And similarly, we also see the same trend occurring for older couples and all older adults. Again, all older adults are in gray and older couples only are in dark blue. So we can see in this low income gap that there has been a decline in overall percentage in this income. And we also see, interestingly, that the single older adults living alone have roughly double the rates of economic insecurity in comparison to older couples. So that was something interesting we've observed. And so more clearly, we see that in 2015, there's roughly 22% of individuals of single older adults in light blue, comparison to older couples in dark blue of 14%. So it's roughly double of single older adults. And we also see that same trend in 2023 with 19% of single older adults living alone in light blue, comparison to 11% of older couples living alone. So the same percentage points of decline is represented through older couples only, which is in dark blue. But overall, we see for all older adults, we see a 2% 2 percentage point decline. Next slide, please. And so this last panel shown on the screen is going to be focusing on the CEI middle income gap group, which are individuals, again, who are below the CEI and at least 200% of the FPL. And so this middle income gap group, they are individuals who are economically secure, but are still ineligible for many support programs. And interestingly, we see that overall, across all the 3 older adult groups, we did not observe a significant shift in percentage across the 8-year time period. But if we break it down, we do observe some differences. So I'm going to be focusing on all older adults, which are represented through the gray line. From 2015 to 2021, we saw that there was the greatest amount of increase across this group, which was starting at 3% in 2015, and then it peaked at 5% in 2021. And this is again for all older adults in the gray. And then from 2021 to 2023, we saw the percentage of individuals of all older adults declined. So it went from 5% to 4%. So there was a slight decline within that time period. And although the percentage shift was not significant across all the three different groups of all older adults, older couples, and single older adults living alone, the raw numbers or the raw population numbers capture the change. So for single older adults in light blue, we saw that in 2015, there were roughly 54,000 individuals occupying this middle income gap. In comparison to in 2023, there were 74,000. And similarly, for older couples, there were 64,000 individuals of older couples in this middle income gap in comparison, and then it increased in 2023 to 77,000 individuals. So as we see through all three panels, throughout all the income gaps, we observe that the single older adults living alone have the most significant shift in trend throughout the years. And this will be integral for our next slide, which will be focusing on the trends in economic insecurity by housing type. So now we'll be going more granular into single older adults. And the time period of the data will still be from 2015 to 2023. Next slide, please. One more. And one more, please. Okay, so again, splitting it up into those three different income gaps that we just talked about for the overall adults, we're going to be focusing on single older adults by housing type. So now the yellow line demonstrates the homeowners with mortgage. The blue line represents homeowner without mortgage, and then the light blue line represents renter. So in this first leftmost panel here with the income below CEI and FPL, we saw that the overall there has been an increase in terms of percentage of individuals occupying, percentage of single older adults occupying this income gap. However, the most the most significant shift that we wanted to point out was through the single renters. So we saw that economic insecurity was most common with the single renters for this income category. And we saw that from 2015, we started at 34%, but then in 2023, it ended up at 36%. But overall, in this category, we see that there is an increase in overall like percentage points increase in this category. And similarly, moving on to this middle panel with the CI low income gap group, we see that for single older adults, across all the three different housing types, there is an overall decline in economic insecurity for all the housing types. However, this decline is attributed to the shift. So there has been a shift now where this decline is now going towards the income below CEI and FPL and the CEI middle income gap. So that's the reason why this decline is occurring. And again, in this middle panel, we see that the shift is most significant in the single renters with 30% in 2015, and then in 2023, we result in 26%. And then finally, in this last panel of the CEI middle income gap group, we see that single older adults living in homeowners with a mortgage type of housing, they have stable rates of economic insecurity where they start off at 14%. And also in 2023, it's also 14%. But contrary to the other income gaps that we've observed so far, the housing type for this income category group is going to be homeowners with mortgage. It has the highest rates. Next slide, please. So these trends for single older adults that we have been observing thus far are also consistent across different demographics. So on the screen, we have bullet points of three different demographic groups or three different characteristics of the single older adults. Can we go back to the previous slide, please? Thank you. So overall, we see higher rates of economic insecurity across all income gaps or all income gap groups for single older adults. But we see that it's more common for those, thank you, for those 75 and over, and older single women, as well as Latino, Blacks, or African American and Asian. And then I'll hand it back to Dr. Catherine.
Thank you, Natalie and Dr. Imelda, for those great presentations of data. So if we take all of this together, I think we've come to the conclusion that to promote older adult economic security in California, we really need a more comprehensive policy response. There are multiple sectors and points of entry from which policies and programs can be developed to respond to the identified economic and social needs of older adults, including the sectors of housing, health, transportation, food, and other social services. The CEI enables local communities to assess levels of need using more accurate estimates of the cost and income factors that contribute to the economic security of older adults, and to use this information to allocate resources more equitably to those most in need. This is the time to improve and expand access to programs and services that can help support the economic and basic needs of older adults, particularly at the local level. Anyone who lives in California knows that access to affordable housing is one of the top policy and social justice concerns of our time. Homelessness overall has been increasing, and aging adults, those 50 years and older, are the fastest growing group of those who are currently houseless in California. Nearly half of single older adults who are houseless are aged 50 and older. And a recent study indicates that most became houseless due to reduced or lost income that made their housing situations untenable, unaffordable. Estimates of food insecurity among older adults in California in 2023 ranged from 8.8% up to 11.4%. And these rates are even higher for those who are single, for those who are Black or Latino, and for those who have disabilities. Housing, food, and economic insecurity clearly contribute to problems with access to care and poor health outcomes for older adults. So in this time of retrenchment and erosion of the public safety net, the economic security of older adults is more at risk. Economic insecurity among older adults over time, the CEI can provide policymakers, program planners, grant writers, advocates, and direct service providers with the evidence they need to make decisions about the allocation of resources, to develop interventions, programs, and policies that identify and assess those who may be most in need or at risk, and to take action by implementing solutions at all levels and across all sectors of policy and practice. Such efforts need to be expansive and creative in these times. They need to build on existing resources and use collaboration across both public and private entities, forging public-private partnerships, both philanthropy and corporate social impact compacts to address the basic day-to-day needs and to fill urgent gaps in access to care and support. The good news is that there are many examples of how the CEI has been used in the real world, and here are just a few. As I mentioned earlier, the area agencies on aging in California are required by law to use the CEI in their strategic area plans, which make decisions about the allocations of resources at the local level to ensure that a broad range of programs and services they deliver are responsive to the local economic and social needs of their older adult populations. The city of Santa Monica developed a housing subsidy program called Preserving Our Diversity, or POD, and they used CEI cost of living estimates to identify economically insecure older adults in the community and to provide housing subsidies to their rentals, preventing them from being evicted, losing their long-term housing situations, and becoming houseless. Justice in Aging, a national organization that uses the power of law to fight senior poverty, used the CEI to estimate the additional number of low-income older adults who would have access to more affordable health care in several California counties if the income eligibility criteria for the Medicare savings program were increased. The Medicare savings program helps low-income consumers with the high costs associated with Medicare, including premiums, co-payments, and deductibles. Finally, Serving Seniors is a nonprofit organization in San Diego County that helps seniors in poverty live healthy and fulfilling lives. They have used the California Index data to justify the expansion of their senior nutrition services. For example, they persuaded county officials to expand these services using pandemic stimulus payments after demonstrating the economic insecurity of seniors in the area through the Elder Index. And they've also used the CEI to measure the positive effects of their affordable housing and nutrition programs. So for future directions, what are we going to do next? Well, in the immediate, we will seek the sustainable resources that we need to continue to generate CEI updates for the next years, 2024-25 and beyond. At the same time, we'll continue to identify ways to enhance CEI as an equity tool by integrating other important cost factors into our calculations. For example, the cost of long-term services and supports, both institutional and home and community-based care, are exorbitant. Medicare does not cover these long-term services and supports. They only cover a very limited set of shorter-term medical services, usually connected to acute care events. Medicaid, or Medi-Cal as we call it here in California, is the largest payer for long-term services and support, but it has both income and health condition criteria in order to qualify. Only about 10% of older adults, 65 years of age and older, qualify for Medi-Cal. We also plan to continue what we're doing here today. We'll continue to get the word out about the CEI, providing information about CEI updates and enhancements to a broad audience of people who are interested in the health, social, and economic well-being of older adults. We will offer CEI trainings and data dashboard user guides to local governments, community-based organizations, direct service providers, advocates, and others who value and serve older adults in their communities. In fact, we will be conducting an in-person workshop on how to navigate the CEI dashboards at an upcoming C4A conference that will be held in Garden Grove on November 6th. C4A, for those who don't know, is the California Association of Area Agencies on Aging. This QR code will link you to our project webpage here at the Center for Health Policy Research. You can access our publications, a couple of fact sheets that we developed that cover some of the information that we've shared here, and then some, and more information that we were able to convey in this relatively short period of time. We also have some infographics for quick snapshots, the facts that have been extracted from the CEI work that we've been doing. And importantly, the links to the data dashboards, the cost of living and the demographics dashboards, which we hope you'll all visit and start to get familiar with if you aren't already, and continue to use and share with others in your community who can benefit from these resources. Really appreciate everybody who joined us today, and looking forward to any questions and comments you may have to share with us. So thank you.
Thank you so much to the entire CEI team for this presentation. My name is Tiffany Lopes. I'm the Director of Communications at the UCLA Center for Health Policy Research. I've been the one who's been dropping a lot of links in the chat and answering some questions. So we're going to get to audience Q&A now. We have answered a lot of the questions that have been coming in, but feel free to use the Q&A function in Zoom to ask any additional questions. Catherine, before we start the Q&A, there was a point in the policy implications slide at the very beginning where your audio cut out. So I was wondering if we could go back to that slide and tackle sort of the very first bit of it.
Oh, sure. Sorry, I did see a note that came up. It said internet connection is unstable. So I'm not sure where exactly it cut off. I shared some examples of how CEI has been used. That was a little bit later. Was it okay then?
Yeah, it was at the beginning.
Okay, it was at the beginning of the policy.
Oh, it looks like you're frozen again. It really doesn't want you to read these policy implications.
Oh no. Oh no, yes, it's giving me the unstable message again. Oh.
All right, let's give it a shot, and if not,
Okay,
Perhaps you can come into my office, which is very close by, and my internet for some reason is working.
okay. Can you hear me now?
Yes, we can.
Let me try to run through these. So I was saying that based on what we've learned from the CEI, we feel that we really need to promote older economic security in California using a really comprehensive policy response. Our multiple sectors and points of entry from which policies and programs can be developed to respond to the identified economic and social needs of older adults, including the sectors of housing, health, transportation, food, and other social services. The CEI enables local communities to assess levels of need using more accurate estimates of the cost and income factors that contribute to economic security of older adults, and to use this information to then allocate resources more equitably to those most in need. And this is the time to improve and expand access to programs and services that can help support the economic and basic needs of older adults, particularly at the local level. Anyone who lives in California knows that access to affordable housing is one of the top policy and social justice issues and concerns of our time. Homelessness overall has been increasing over the years, and aging adults, those 50 years and older, are the fastest growing group of those who are currently houseless in California. And more shocking still, nearly half of single older adults who are homeless are over the age of 50. A recent study indicates that most became houseless due to reduced or lost income that made their housing situation unaffordable. Okay, I got that part. Was there a little
Yes.
more? Did you hear me talk about food insecurity? Estimates of food insecurity among older adults in California in 2023 ranged from 8.8% to 11.4%. And those rates are even higher for those who are single, those who are Black or Latino, and among those who have disabilities.
Yes,
And,
we got the food insecurity, so we're
Okay.
right at the spot.
We're at the spot. Okay, good.
Great. Let's start some Q&A. If folks, the panelists can turn their videos on. Can you reiterate why there is a need for a CEI versus an overall affordability measure for adults? Is it because their costs are different, higher for healthcare, lower without childcare?
Yes.
I can take that. Yes, you know, there is the Elder Index did build off of the I think it's called the Family Self-Sufficiency Standard. And so that looks at costs for adults under 65. So looking at more like families and, you know, looking at different household arrangements, you know, do they have children? What age are the children? So there are different costs associated with different age of having a child. You know, when they're younger, you have more childcare expenses. So the Elder Index built off of that to make an index for older adults because they do face more healthcare costs. The healthcare costs that we went over today is for an individual that's in good health. So, you know, for older adults who are in worse health, you know, their healthcare costs are going to be a lot higher. And this is going to be, you know, something that we hope to be able to move forward with is looking at some, you know, long-term services and supports for older adults who are in worse health conditions or, you know, have a disability. So that is probably one of the main reasons, you know, the different spending, the different percentages in spending by categories is why we need the CEI.
Thank you. What is the cause for the different trends? This question was asked in the chat. I think
Do we know
Lauren,
which trends they're talking about?
I think the question was referring specifically to the trends in the increasing people in poverty and then decreasing CEI low income gap and increasing CEI middle income gap.
Oh,
Thanks, Lauren.
okay. Yeah, no, it was a very interesting trend that we also found. I was expecting there to be an increase in the CEI low income gap. So those that are what people normally call like near poor or near poverty. I was actually expecting, when we were looking at trends, to see the opposite, that there would be an increase in that group. But what we're seeing is more people are moving into poverty, which could be because of, health conditions deteriorating. And so they're actually moving into poverty, not that they have lived in poverty. So that could be one of the reasons. And the other reason is why we might be seeing an uptick in what we call the CEI middle income group is that the cost of living has just gotten so much higher. And so as the cost of living gets higher, the people with higher income are going to fall into the CEI income gap. And so I think that's why we're seeing that uptick in that group. And so it's really distributing people with economic insecurity into the lower and middle income groups. So I think that's what we're seeing. It's sort of like the disappearing middle class. And so we're seeing more people that are in poverty and more people that have higher incomes, and that middle class group is shrinking. And so I kind of look at it that way.
I might add that as the cost of living, as you point out, Imelda, has increased, the income support programs have not accordingly increased to match that cost of living. So the major programs that older adults rely on, like Social Security, and for those with lower incomes who also may qualify for supplemental security income, those programs have not risen to meet the occasion of increasing cost of living by any extent. And those also have become more difficult in many cases to access. Also, in our day and age, there are fewer pension programs that come through employers. So that's a reality of the shift in the workforce benefits that used to be more readily available to previous generations to support them in their older years, in their later years. So with these fixed incomes not coming close to the exorbitant increase in housing costs and food and everything that we've seen in inflation in recent years, I think helps to explain some of the changes and increases in economic insecurity overall amongst this population.
Thank you. Regarding healthcare costs, does the dashboard include the percentage of older adults by socioeconomic status, renter/homeowner, marital status, et cetera, that are enrolled in specific types of Medicare Advantage programs? For example, general enrollment MAPD versus a DSNP.
We do not have that level of specificity in the way that the healthcare costs are estimated in the dashboard. So you may note in the dashboard, you can definitely look at healthcare costs as they're estimated per county. And as Imelda pointed out in some of the earlier slides, how those vary from California average, how they're different in urban and rural counties. But these are estimates based on the Medicare Advantage enrollment, as Imelda mentioned earlier, and they don't really break into that level of specificity. It would be hard to add to it this kind of a dashboard too, I might add, for what I'm learning about dashboards. Imelda, something to add?
No, nothing to add.
So I realize that we're at time, but I do want to get one last question asked before we close. And just remind folks, if you do have additional questions or something that didn't get answered, you can email us at healthpolicy@ucla.edu. The last question is this information being shared with elected officials to help educate them when making new policies for older adults? Also, does this dashboard, or does this feed into the CDA dashboard from the master plan on aging?
Thank you for that question. Absolutely. Most of the work we do here at the Center for Health Policy Research is designed to translate to policymakers so they can use the research we do to inform their decision making. We work with a lot of community partners who are sort of the legs on the ground, who are really skilled and able to do that. And we try to create products that facilitate that, so the infographics, for example, that are really brief, but convey some very important high-level factual information can be a good product for a policymaker. But as I mentioned, in terms of our future steps, this is all of the training and the sharing information about the CEI dashboards. We really want to spread the word for those who haven't used it before and those who haven't used it because we hadn't been able to update it until recently with this great funding from the California Department of Aging. And that reminds me of the second part of the question. Yes, the CEI information has been an integral part of the data dashboards that CDA has put together for the master plan. And they're also using National Elder Index measures as well. So when you go there, you may see us in a certain place. You may see the National Elder Index in other places, but it is part of the dashboard. It's part of the data points that are included. And again, we feel really pleased that we're able to get down to the sort of county level with some of the demographic characteristics and household types, which are more common and more broadly represented in California, so that it's very responsive to the California context. So I hope that answered that question.
Thank you. And thanks to all of the panelists. We did get a question actually from an undergraduate student who asked how they could get involved with this research, a UCLA student. And as you can see, there are students here presenting. We have had many students as part of the CEI team, as Catherine introduced earlier. Catherine, any words to say about that? Obviously, folks who are interested in working at the center can email us at healthpolicy@ucla.edu. But as far as joining the CEI team?
Yeah, thank you. Our current funding for this project is wrapping up, sadly. But as I mentioned, we will be doing a presentation at a statewide conference in November. But the CEI work we are committed to, this goes back to Dr. Steve Wallace, many years, and this work will continue. So if you're really specifically interested in this, please do reach out. There are opportunities here at the center typically for volunteering if we don't have a paid position, interning. We love having students here. We have been blessed to have this team, so much talent, so much motivation, and so much, such a high level performance to be able to bring together all of these CEI products. And you only got a little taste of them today. You could also possibly reach out, connect you with the students who've worked on the team, just to kind of learn a little bit more about their experiences. I think that might be another avenue for the immediate.
I also just wanted to add, even though our funding is coming to an end, we are planning, one of our students is presenting at APHA this year, and she got an invitation to apply for, what was it called, Lauren?
The Master's Student Research Award.
Yes. And so we are planning to turn her poster into a manuscript. And so, if this undergrad is interested in working with us on a manuscript and doesn't mind not being paid, we would definitely love to have you on board. So, reach out.
Yeah, definitely reach out to us. Thank you for that info. Also, if you will be at APHA, we have a booth. Stop by, come and meet some of the researchers. Catherine will be there as well. So we definitely invite you to come over and pick up some of our swag and tote bags. But once again, thank you. Apologies for being 5 minutes over, but I think it was worth it. If anyone has any additional questions, feel free to reach out. Have a lovely rest of the day. And don't forget to register for the CHIS data release. Thank you.
Thanks, Tiffany. Thanks, everyone.
Thank you, everyone.